My name is Carla Nivert and I am extremely passionate about pregnancy, birth and babies and helping you to find your way through and embrace both the messy and magical things on this extraordinary journey of bringing your precious baby into this world. I'm a small town mama who has taken a leap and become a certified birth educator and have a very deep desire to help as many mothers as I can around the world. I want you to feel ready, confident and excited to go into labor so you can have your best chance at a smooth, calm and a beautiful natural birth. So please get comfy and ready to learn all you need to know to feel prepared and informed about your pregnancy, birth and easing into breastfeeding with confidence. We won't shy away from the real talk. This is the Birth Serenity Podcast. So Natasha, thank you so much for taking the time to come onto this podcast. I really appreciate it so much. For the listeners, my first born, my daughter Marna, she was born with Natasha. So I hold a very special place in my heart for her. She's an amazing midwife. But Natasha, maybe tell us a little bit about your career as a midwife, what you've been doing in the past, where you've worked and what you're busy with now.
Hi Carla, thank you so much for having me. It's an honor to be with you. That's quite a long story. So I have been a midwife for about 30 years now, 30 plus years actually. And I always have been a midwife for 30 years, but I've only known what childbirth is for about 16. So that's when I started doing home births and working independently. Before that, I worked in Switzerland for a long time. And I trained in South Africa. So I trained here in South Africa in Mowbray and Cape Town and worked here for a bit and then went overseas for a long time and came back in 2005 and started working as an independent midwife in 2006. And I think that is me in a nutshell. Obviously, I love my home births. I'm very privileged in the sense that I have wonderful support here from the medical system when I do need them, and I have amazing doulas that I work with. I do on average about 60 to 70 births a year, which is great, and just completely love what I do. I think it's really important that women should be allowed to be free during their birth process and should be given the freedom to choose how they want to birth and where they want to birth. And at the same time, obviously, it is great to have the medical support if we do need support and if things need to be moved from home to hospital. So I'm very, very happy and very grateful. We've recently moved our whole birthing area upstairs, Carla, so we have a big birth room now. We have actually two areas where moms can come and birth, so we are still very much enjoying what we do.
Oh, that's wonderful. Yes, every time we go out to Somerset West, I will tell my daughter, if you go up this street and you turn right, that's where you were born. She's always so happy to know that, that's her little place. She was born there.
I hope we see you for a cup of tea next time.
We have to do that. I'll come show it to you. Okay, so today we are talking about spotting and bleeding during pregnancy. This is something that mothers, they get a big fright when they go to the toilet and they now see that there's blood. Immediately they think that something is wrong. So today we're just going to address this topic and see what is normal and definitely what is not when you have to go see your doctor. So maybe first tell us, what is the difference between spotting and bleeding?
I think the main difference there would be that bleeding is usually more than spotting. So spotting is normally very little and it's normally quite light. Though it can vary. Sometimes it does unsettle the moms a bit. So I normally just ask my moms to observe for a bit, and I normally say to them, look, if you're not losing more than a teaspoon of blood and it's not too fresh and it's not too often, then let's just see how you go. And I think also important is that bleeding, if it is an indication of an unfortunate miscarriage or so, then it does normally come accompanied with cramps and with a feeling of discomfort as well, whereas spotting doesn't normally do that.
Okay. So what causes it during the first trimester? I believe it's more common to be seen in the first trimester, and then also in the second and in the third trimester. What is the cause of it in each stage?
So there are different causes, obviously. So let's start with the normal ones that we don't really need to be concerned about. So in your first trimester, it's what we call an implantation bleed. So this can happen when the ovum attaches to the uterus, and sometimes this can cause a little bit of spotting or a little bit of blood. Sometimes there's also an increase due to the pregnancy and the increase blood flow to the cervix. There can be a little bit of that, especially if you've been intimate or there's been other stimulation that way. It's possible that you have a bit from that as well. The sort of more relevant ones that we want to hear about, if they continue, could be for an ectopic pregnancy. So this is where the pregnancy actually happens outside of the uterus. So it's often in the fallopian tubes that the ovum settles there, and then obviously as the ovum grows, it causes discomfort and can cause bleeding of the bleeding as well. And then you have one or two rare placental abnormalities that can also cause bleeding, but I don't think we really need to go into those. They're very, very rare. And sometimes you can also have that there are unusual growths, not necessarily malignant, but there can be polyps or different growths in the uterus that can cause that as well. Though I would say those last two you would see more in the second trimester. And then in the second trimester, as your uterus grows, then you also get a thinning of the line of the uterus. So that means the uterus sort of starts moving up, and sometimes the placenta then also just loosens just a little bit, which is not really an issue as the placenta grows. So that's possible. And the other possibility would be if the placenta is in front of the cervix, then as that moves up, it can also just dislodge a little bit, which doesn't really have to be a problem. Third trimester bleeding we don't like very much, because then normally the uterus is already settled in its growth, and we need to exclude your placental abruption, so where the placenta does start loosening. Sometimes it just loosens a little bit. It doesn't have to be an emergency, but it is something we want to check very closely. And then obviously also if the placenta is still over the cervix, so placenta previa, then we would also have to check and see what is happening there, to make sure that every time, obviously, if the cervix starts dilating, or if the cervix moves, and the uterus grows up further, then it can also cause bleeding there.
Okay, so definitely there are circumstances under which it can be normal, so you don't always have to get unsettled and worry if you see a little spotting or bleeding. But when should I definitely call my doctor? When I see what?
So I like my moms to always contact me when they have bleeding, just because I can then speak with them and calm them down a bit, and we can go through it together and say, look, this looks quite normal. I think, as I normally say, if you're bleeding more than a teaspoonful, then one should actually contact a health professional just to make sure that everything's okay.
Okay. So towards the end of pregnancy, we hear about sometimes mothers see the bloody show, as they call it, come out. That's right at the end of pregnancy. So what does that look like? And if it comes out, is it an indication that labor will then start soon, or is that not necessarily so?
So now that is a question I get asked a lot, and after 30 years I cannot answer you. So my response to that is, your bloody show can take on all forms. You have some moms that just have an increased amount of discharge in the last month or two of their pregnancy. You have some moms that can really see like almost a cork of slimy, browny, mixed, greeny, whatever mucus comes through. And then you have moms that have a little bit of fresh blood, and you have moms that have no fresh blood at all. So it's very, very different. And I think that's all good, as long as there's no fever or offensive odor or anything attached. That's all good.
Okay. And if that comes out, should labor start within a certain amount of time after it being dislodged, or is it fine if it comes out and no contractions start?
So the labor can take quite a while after the mucus plugs come out. The mucus plug is not really an indication that your labor is going to start soon. It just means that your body is getting ready. How long it takes to get ready, that depends obviously on the birth and on the mom and babe themselves. So I think, and there's definitely no danger of the mucus plug coming out. So what happens as well is the baby's microbiome really starts building up in the womb. So a little bit of a introduction, let's say, put it that way, is not a bad thing for babe. And then also your amniotic sac is still closed, so your waters haven't broken, so your baby is still in a protected environment. So we don't really attach any significance to the mucus plug coming through at all, unless of course if it is in early pregnancy, then it could be an indication that the mom might go into early labor, so we just want to make sure that her cervix is still closed.
Okay, so Natasha, maybe before we sign off, any last thoughts or words of encouragement or something you'd like to add maybe before we end this episode?
Sure. First, I would just quickly like to backtrack on the ectopic pregnancy. We were talking about the pregnancy outside of the womb. So this is also important for the moms to just check and have maybe go for an ultrasound to make sure the pregnancy is in the womb when this happens, especially if there's pain involved as well. So if there's a little bit of bleeding or she feels pain in her first trimester, then it is important. So she normally feel pain sort of in her middle sort of abdominal area. So not in the middle, but on the sides, sort of at the level of the umbilicus. Because that is normally where your fallopian tubes would be if there would be a problem. So it is important for her to just quickly have that checked out if she feels that there's a slight bleeding and she has constant pain. The other thing is that obviously if she is losing a little bit of blood and she is having contractions or she's having cramps, it's also important for her to just contact her care provider. What I'd like to say to all moms is that I love you very much and I still enjoy very much helping and assisting moms with birth. I'm still in awe of how you just walk the walk and go through this incredible journey, however wonderful and however tough sometimes it is. And I salute you all and I hope you have a wonderful pregnancy. And I'd like to also encourage all moms to, especially first-time moms, but actually all moms, to, if they can, have a doula. I find it makes a huge difference to have a birth person to assist you who can take over a lot of the little stresses of is this normal, is this not normal, when you cannot get hold of your care provider, and also can take care of the logistics. When do I go? When don't I go? Who do I phone? How do I do this? So yeah, I really do commend them. I know that they do amazing work. And thank you very much for having me, Carla. Thank you for having me on on your podcast. And I've been seeing the wonderful work you do, which is amazing. And I think, I always say to my moms, if you don't own your pregnancy, someone else is going to own it. And it's wonderful to see young women like yourself being out there and owning the birth world and bringing all sorts of wonderful information to moms.
Yes, thank you, Natasha. It takes a lot of us doing this to get the right information out there.
But we'll get there.
Okay. Yes, we will. Are you pregnant, hoping for a smooth, calm, beautiful natural birth? Let us help you with that. In the Birth Serenity Antenatal Program, we focus on natural birth and would be honored to help and support you to prepare yourself in the best possible way, both mentally and physically, for your birth. Our aim is to help you find peace and accept your birth, which whichever way it turns out. For more information, go to birthserenity.com.